Cliff. I would like to invite the other panelists out now. And again, we'll circulate cards that you're welcome to add questions. And we'll try to get through as many of them as we can. Yes. First set of questions. When historically did healthcare costs become so unmanageable in this country, and what contributed to this? And a follow-on, what is the real impediment that prevents everyone from being able to afford healthcare for themselves and for our society as a whole, to pay for those who can't afford healthcare, even if the costs were reduced? Is the impediment insurance companies, supply-demand issues, fear of the socialization of medicine from the medical pharmaceutical insurance complex, something else? None of the above.
Who wants to take that first? Jerry?
I'm not sure that you could get 100% agreement that costs are unmanageable. If you're facing a life-threatening illness, many will say, at any cost, take care of me, or if it's a loved one, same type of thing. So that's at a sort of anecdotal level. There's a study that's been done. I think it was the name of the book was Business of Health, and it was published by, admittedly, sort of a right-leaning organization, American Enterprise Institute, which looked at per capita health expenditures when you adjust for wealth of a country, not a linear function. I apologize for the jargon, but sort of a curvilinear function, fitting a curve to what's going on, and we're sort of on track if you believe that. So those are our two exceptional positions. I would say, from my vantage point, if you think about the income distribution, we're starting to get to the point where middle class, lower middle class, is feeling a squeeze. They're feeling pain. People that are making $40,000, $50,000, $60,000, $70,000 a year, in that range, they're not getting raises as they would like to. Premiums are rising. Premiums are rising because more is being paid, not so much in the fees, but in the use of services. And they're saying, not sustainable. They're saying, I'm getting squeezed out. It's a very personal thing. I mean, it's going to feel more painful in places like Texas, which are a lot more expensive than upstate New York. It's going to feel more painful if you have a $15 copayment policy versus, a $1,000 deductible policy than a $15 copayment policy. So it's in that space. I think what happens is when the pain gets to a certain level, they say that maintenance of the status quo is more painful than change. And you can almost imagine a survey that would come out with something like that. I think we're getting close to that point, if not at that point, as a society. When you look at the surveying data, that's what's coming back. The drivers, I wish I could tell you that the drivers, we're in the insurance part of the equation. The insurance part of the equation represents about 10, 12%, maybe 15% of total cost. And the profit margin, and this is something which Nancy Pelosi doesn't like to hear, the profit margin last year for the industry was 2.2%. Okay? It ranked number 35, below a lot of the elements in healthcare delivery. If you were to wipe out the insurance industry overnight like that, let's assume you did that. Okay? You notch that curve, that inflation curve, which is going up about 8% a year, 9, 10% a year, by that 10, 12 points. In 2 years, you've eaten up what they would contribute. So it's really on the other side. Now, what's on the other side that's driving up that cost? And how many of you, 25 years ago, knew what cholesterol was, or if you did, were taking a statin. How many of you, when you heard about cancer, you thought it meant death as opposed to having a chance of survival? How many of you, when you had coronary artery disease, blockages in the vessels that feed your heart, had to have a bypass surgery, an open heart procedure, open chest procedure versus a stent? How many of you, knew somebody with AIDS that would die from AIDS? Those are all technological advances. You can't go to a doctor now and get a prescription for a brand name drug that's less than $5 a pill. Okay? I mean, that, as Ron will tell you, or maybe did, I stepped out for a second, cost of drug development is approaching $1 billion for one new drug to come online. And that's what's driving this. How do you slow that down? I mean, at some point, and if you do the cross-national comparisons, you'll find at some point the answer is no. Okay? And no is sometimes an absolute no, and sometimes it's waiting. There's Ontario Ministry of Health has a website. I encourage you to go onto it. Google Ontario Ministry of Health. There's a little box up in the right-hand corner, a little search area. Type in waiting times. Okay? Pick something. Diagnostic CT scans, okay, which we all get. You bang your head, you get a CT scan. You have cancer, you get a CT scan. Okay? Pick a space, downtown Toronto, central Toronto. Okay? It comes back with the average wait time. Did this recently. It was 46 days. Okay, you can go do it. Go do it. And the range was 11 to about 90 days. Okay? Why is it that? Because they constrain capacity. And they do workload balancing by queuing. Okay? Are we willing to accept that? I don't know, maybe. But that's what it's going to come to if we're going to break the back of those cost curves without taking waste out.
Ron?
Picking up on David's points, but putting them in a slightly different framework, instead of talking about the cost of health care, I often talk about the cost of illness, which includes, for sure, the cost of health care, but it also includes what economists refer to as the indirect cost, which is early deaths, morbidity, and the like. So that the total cost of illness is composed of two parts. That which is sort of, even though we call it indirect, it's really the direct cost, the shortened lives, the early deaths, morbidity, whereas we also have on the other side the cost of health care. Now, if you look at any of these statistics, it's very easy to find statistics about what is spent on health care. The national tables have that, and most of the debate has focused on the cost of care rather than